Hi, Kim. Glad to be with you again. It feels like it's been a while since we've actually been able to connect. So, looking forward to our time together today to talk about more prodependent concepts.
Absolutely. Glad to be here. Glad to be back. I know Dr. Rob covered last time, and I hope everybody was able to participate, who normally comes. That was a treat, I'm sure. So yeah, I'm happy to be back today. And just a reminder to please ask any questions, maybe questions you've had that you didn't know who to ask or where to go, and I will give it my best. Tammy and I will. Like Tammy said, I've been working with this concept with Prodependence with partners in my own practice and in the agency I work for, particularly partners of sex addicts that are healing from that betrayal since probably last August or September of last year, and it's been very successful. And it was a big shift, but it wasn't a hard change, if that makes sense.
It does.
Those of you who have done sort of recovery, or healing or have been through therapy around this issue know that there's baseline concepts that still are very applicable, but changing how we see a partner from a codependent perspective, we see partners' efforts to help and to heal and to try and stay connected in a nearly impossible situation when you're with an acting out addict, as heroic and understandable. And so we don't pathologize any of you who are in those relationships in any way, or meaning give you a diagnosis of any kind about being in that relationship. And there's a lot of trauma and a lot of things that come along with that when betrayal happens. And so when I heard about Prodependence, I heard Dr. Rob talk about Prodependence, I was immediately drawn to it, as I work so closely with this population of partners and loved ones of addicts. So it's been really successful. So over the few months, I guess, or weeks or times that I've been doing these free webinars, I've been going through different concepts around and kind of a little bit of preview, if you will, of hopefully what's going to be coming out this year, an accompanying workbook to Dr. Rob's book that will be available to the general public. So it will give you and give people sort of guidelines, something to work from with actual concepts and exercises and things like that. And also things you could take to your therapist if you see a therapist and have he or she help integrate this into your healing work that you do. So there's not a right or there's not a wrong question to ask or a weird question or a dumb question. There's just questions. So I hope this will be more of a discussion and not just me talking, because that's boring. Bore myself doing that. And Tammy will let me know when there is a question. And until then, I'll just kind of maybe introduce or talk about some of these concepts, and maybe that strike a question, in you that you might have wanted to ask and haven't. So one thing that was on my mind that we haven't talked about in these is disclosure, the disclosure process that sometimes happens organically, meaning the couple does that on their own, but we really, in the therapeutic world, in this world that I work in, we really suggest you get good therapists, trained therapists that can help you do that if needed, to do disclosure. It makes it safer generally for both individuals to have therapeutic help with that. And it also creates a safe environment so that you have the support you need from your therapist, and you have all sorts of tools and things that you can use at your disposal to help you get through the rockiness of hearing that information. Disclosure means the addict formally disclosing the complete history of the acting out behavior. That would be a formal disclosure, but in the presence of both the partner and ideally both the partner and the addict's therapist. We do this quite often with couples as they come into treatment. It would only be warranted if you are not heading for an inevitable divorce. We wouldn't do a disclosure. In that case, there would be no need to do that. But if we are looking and working on repairing a relationship that's affected by addiction, then that's something that would be really important for the addict to become completely honest and become clean with all of the history of the acting out, and for the partner to be able to be in the know. And so that he or she can make informed decisions about the relationship moving forward. So that's something that I thought might be an interesting topic for discussion today. If you had any questions around disclosure, I can continue to give a little bit more information, but might be something to think about.
Well, I'd like you to discuss an organic disclosure, because that sounds like so healthy, and like I picked it from the grocery store, and what I receive when I get phone calls about this is pain. So can you discuss some of what happens when people decide to disclose on their own, or talk a little bit more about that, please?
Absolutely. Thank you for clarifying that. When I say organic, I basically just mean the couples doing it on their own. And sometimes that just happens. It's just the nature of maybe somebody gets caught with, maybe a partner catches an addict doing something and it blows up and all that information comes flying out. Sometimes it happens, when I say organic, kind of that way. Generally, though, there's so much emotion involved on both sides that we encourage you to, it's important that you know what's going on and maybe get the basics, but that you work with a therapist to help the addict, for instance, to help he or she figure out how to, sometimes a lot of things get lost in addictive behavior. The addict isn't always, when they are acting in their addiction, they're in oftentimes what we call the limbic brain, the part of the brain that's not thinking clearly. It's not our higher thinking, executive functioning brain. And so things can get lost. Details can get lost. And then there's deception and lies and gaslighting and all that. So it gets really messy. So when a partner goes to an addict and says, I want to know everything you've done from day number one, blah, 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 I want to know everything. And the addict looks at the partner and says, and they bumble and they fumble and they get defensive. And some of that's intentional and some of it's not. Some of it truly, they haven't really thought through it. They've just been acting. They've been reacting to life. They've been surviving in a very dysfunctional way. So by organic, I mean doing it on your own without help. And I would highly suggest that is done in a therapeutic setting with therapists who are trained with whatever the behavior is, whether it's substance addiction or it's sex addiction or gambling or whatever those are, that they have very specific training and they know how to do a disclosure. They've done disclosures before. And if they haven't, they have supervisors who have, because they can be one of the most healing sessions that couples do, and they can be very damaging if not done correctly. So we want, our purpose in disclosure, again, is just to help the addict come completely clean and really get their recovery on track. Like, to totally become aware and responsible and accountable for all the elements involved in their deceit to themselves and to the people they love. And then for the partner, we want the partner to be able, again, to make safe, informed decisions. If I don't know some of those details, then it's going to be hard for me to know if this is something I can live with or not, or what kind of boundaries I might need in order to stay in the relationship. So that's more what I'm talking about in that, in the organicness. I wouldn't recommend it. Sometimes you might, if you find out something, if you're a partner and you found out information and the addict has not come clean about that, you can confront the addict and just say, look, after you confront the addict and you find out this has happened, I'm going to need some help with this. I need some time to think, and I need probably need to get myself a good therapist and get myself some support so I can think through what my next steps are. So disclosure happens in the therapeutic process whenever that couple is ready. That might be very early on, and it might be a few months down the road or weeks. It just really depends on the couple. And, you know, if the partner is really traumatized and not feeling safe at all and feeling emotionally, you know, spinning emotionally, we might have to wait until some of that settles, because the disclosure itself can be unsettling. So we want the partner to be in a safe space for that. But I find honest disclosures produce really good outcomes, as far as now it's kind of like we've evened the playing field. You know, we are both on the same page. I know, as icky as it is, I know the truth. This person's come clean with the truth. And now we can decide, you know, and take our time deciding from an honest place where we want our relationship to go.
I think that there's so much that comes with disclosure, and it is very hard. Like, I love what you said about, you know, the partner going, hey, taking a step back, and I need some support around this. But I think human nature is, what? You know, tell me everything. And I feel so bad, because often the partner gets these images that they can never not see now. And so I think what's really important in working with professionals is they help pull things together in, as you said, you know, when it's all discombobulated and, you know, you can't make heads or tails of it. You know, a therapist can help with the timeline, help, you know, put some things in compartments where it's like, okay, you know, this is how often you acted out with this. And so you can pull the data together in an organized fashion. So when it's presented to the partner, you know, it's done in a way that's going to best serve the partner and the relationship, you know, as well. And then I was thinking too about the, you know, there are times when a partial disclosure is necessary. There's a medical issue, you know, that, you know, like you know, you're going to need to go get STD tested or whatever, you know, there are some things like that. And also when you may be outed on a more public way, like you may be in a profession or something, or, you know, your affair partner's spouse found out and is going to be calling your whatever. There's lots of cases where there's an urgent need for some form of disclosure on some level. But I really think, you know, and I've talked to a lot of partners about this too, is like, you know, because they're like, I deserve disclosure now. And I was like, you deserve, you know, a safe, you know, a safe event for this, because the disclosure is kind of an event, you know, but, you know, like, is your partner done acting out? Like if they haven't sustained any real recovery, you don't want to do this in 3 more weeks and then another month and whatever. So, you know, I think part of getting some time behind is, you know, so that they can figure things out, but also so that they can show that they're able to sustain a recovery path. So this isn't just a, you know, the next, well, now there's the next disclosure and then the next one. And I mean, that, you know, that would be so traumatizing to just be going, well, I'm going to get another one. It's just a matter of time.
Yes. Thank you. That is so true. And there are cases where, something's come out or it's urgent for some other reason. You can definitely get maybe even a partial. This is what's relevant to that particular situation. For instance, if the acting out behavior causes risk to the health of the partner, like you were talking about STDs or something like that, certainly we're going to have to know quickly, you know, so that partner isn't at any more risk than he or she has to be. So we would want to know, then we'd pull together how many, where, when, you know what I mean? We'd want to know how many partners and is it protected? Is it not? That kind of a thing. Those are really, really important. I think that's a really good delineation. And then later on, maybe we go through the whole history as you get into therapy and working with therapists that can help you put that information together, as you were talking about. Another question that comes up a lot is, how much do I need to know? You know, partners will ask like, well, how much detail do I need to know about the acting out behavior of my partner or the details of those events? And I think that is very individual. Over the years, doing this for a long time, I think it's really up to the partner, and a good therapist can help you understand. You want enough information to be able to make the decisions you need to make in your life, but you don't want so much that it just gives you more fodder to obsess about and worry about. And like Tammy said, create your own video library in your head that keeps you stuck and dysregulated. And what will be important information for one partner might not be the same for somebody else. But like I said, a good therapist can help you sort of talk through that and figure that out and piece that out. Sometimes I'll have partners come in and they're like, I got to know this detail and this detail. And as we start to talk, we figure out, okay, this is me thinking that those details are going to create more safety, but it really doesn't. It's me thinking that more information is going to help me get a handle on or be able to control this. And it really doesn't. It just causes me more harm. So I will tell partners, this is why this time, like giving it that time to sort it out, is so important. So you're very deliberate in what you need to know as a partner, and the addict's very deliberate in what they are saying and what they are disclosing. And some details are important, some details you got to know. And I've seen partners on both sides feel both ways. Either they want to know so much detail, they drive themselves kind of crazy with it, or they want to sort of not think about it, and they maybe err on the other side where they're in a little bit of denial about or want to stay there because it's so painful. They don't want to hear that information. So a good therapist can help you find that balance and figure out what you need for safety.
I would think that there would be some things that would be important almost across the board, but I may be wrong. But I'm thinking, if the affair partner was a best friend, a sister or a relative, or, if my house, my bed was used, some things would be important for me to know. But, hair color, breast size, all of those things that I wouldn't even want to know, and this is me, so I'm just, kind of going with that. But to me, it seems like there are some things that, because I've unfortunately, and I know you have too, but, I've answered calls with people that were betrayed, and it was their best friend, and that, so, that's like the double betrayal, because now it's not only your loved one who's supposed to be, your person, but it's also your best friend who you're supposed to be able to confide in. And now it's so, some of those things feel like, they really are weighty, and those you need to know. But if it was, somebody, 2 states away, don't need to know names, maybe. I don't know. What are your thoughts?
I think that's very, very true. That usually comes to a safety thing for the partner. Definitely, that would be one of those gotta knows. Gotta know if the acting out behavior is occurring with somebody in my life. I have to know safety around that acting out behavior. And most people need to know frequency. They need to know when, where, what, and frequency. They've got to have some numbers. So we really encourage, where I work, we really encourage that the addict really quantify that. And if they can't come up with a number, for instance, if I visit pornography sites, and I've said that I wouldn't, then maybe disclosure would be, I don't know exactly how many every day, but I know I would go on the internet and at least search or look at pornography at between 3 and 5 times a day for the past 2.5 years. We really have them try and give some number, at least a range. Some of that will not be all available. That's why sometimes ranges have to work. But sometimes, like you're speaking about, there's very specific information that, this is somebody, this is a place, those things have to be told. So again, the partner feels some sense of, okay, now I have the information. There's not things or people out there that I don't know that are, could cause me harm. And then there's situations where it could affect somebody's license to practice a certain, in career. It could make them not be able to drive their vehicle. There's a lot of those details that will have to be disclosed. And as painful as disclosure sessions are, they also can be a really tender space of vulnerability between the couple. As hard as it is to hear, if all of that, if all the work is done for safety around that particular session, it can really start the early process of helping with trust and reattachment. And, where before most of the partners are like, I have no idea, when did this start and where did it start? And what about that holiday? And what about that? And what about when he disappeared for 3 days? And I didn't, or he or she, or whatever. They've got all these questions in their head, and disclosure should serve to answer a lot of those questions. There are occasions when the acting out is serious enough that they may need a follow-up polygraph. And everybody has a different train of thought on that. I find that to be useful in some cases, particularly when the acting out behavior is it could be very harming or has been pretty extensive, or the deceit has gone on for a long time. And sometimes when people do that, the addict often finds that the polygraph turns out to be can be a helpful thing in their own recovery for accountability. I've had some where the partner's like, yeah, I don't really need the polygraph anymore, I'm good. And the addict's like, no, I think I'm going to keep doing my maintenance polygraphs. It helps keep me. So every therapist is a little different about that. So I'll warn you there. Not everybody believes that that's useful. I'm kind of in the middle. I feel like it is in some cases and not in others. So you'd have to get your therapist to help you judge. But it is one tool that can be possibly used in cases where trust just doesn't seem to be able to be reestablished. It might.
I like what you're saying about that, where the addict is going like, I want it, just it's one more thing to keep me honest. But I like that the partner is going like, I don't need it, because that feels like, we've rebuilt trust, and the addict's just going, and I want to be able to maintain that trust. I think I struggle more, and this is just me personally too, with the people that are, going, I need that to know that the addict isn't lying. Cause then I'm like, it doesn't feel like there is rebuilt trust. So, everybody's different. And I think you're right. Find out what's going to work for you. And if it's working for you, great, no judgment or anything, about that.
And sometimes it's just a baseline. Sometimes partners will say, at least I feel like this gives me something to lean on when words are so cheap for so long. I've been lied to so much. They're not foolproof, but a really experienced polygrapher will know how to do it, that works with infidelity or other things like this, will know the right questions. The less the questions, the more valid. The less questions they ask, the more valid the test is. And so somebody who's really experienced, who knows how to do that interview correctly, is really important in picking if that's a tool that someone decides to use. But long term, no. If I have to have a polygraph, maybe for the rest of my life, I may have to ask myself about that relationship. I may have to wonder, is that okay for me to be in a relationship where I really can't build trust? Then I have to, those are hard things to look at. Those are honest looks at no matter how much I love somebody or care, I have to really decide, make some of those hard decisions sometimes about what's healthy and safe for me. And staying with somebody doesn't mean anything. If I stayed with somebody and needed a polygraph, doesn't say anything about a partner either. That might be what works for that relationship. So I think in the Prodependence way, we don't label it that way. We take it individual, one at a time, and we look at that particular person, that particular situation, and say, okay, what's healthy for this couple? What works for them? What constitutes healthy and unhealthy, or connected and disconnected? We're really looking at it individually, not just throwing everybody in a big bucket and saying, well, something must be wrong with you because you want to stay with your partner. And the truth is, anybody who's been with a partner in a marriage or committed relationship for any amount of time, they have a lot of they've usually invested a lot of time. Sometimes they have children, they have all sorts of things they've invested in, and they're don't want to throw that investment away, you know. And it may take them, you know, some time to heal, but they might want to stick it out, and that's not a disorder. It's not.
Correct. And, you know, and we, like you said, would not label that. And unfortunately, well-meaning therapists, family members, whoever will go, you know, kind of like, what's wrong with you that you want to stay with and him? Let's, you know, not to, but him or her, but not trying to label, but, you know, and I'm like, you know, that doesn't, you know, sometimes they're just trying to protect the person that's been hurt. And I get that, but, you know, but at the end of the day, it's like, you know, you know, it would be helpful for you to go, wow, that must be really difficult. How can I support you while you're figuring that out? That would be a whole lot more useful to me than the judgment of, you know, you should fingers wagging. So I was thinking too, go ahead.
You know, the past model, codependency, which most people are pretty familiar with because that's what's been around for so long. And this is what Dr. Rob is trying to change, that culture with this new paradigm shift in recovery, which is not giving a diagnosis or labeling or putting all partners or people who love addicts in a box and saying something's wrong with you. Instead saying, well, of course you love, of course you're hurt, of course you're trying to help them, because that's what we do when we love somebody. We help them. We try and save our family. We try and hold things together because our attachments are everything. That's what we're here. We're healthiest in our attachments. So that's the big shift with codependency, away from the old codependent model, which really wants to give partners and family members this, make them as sick as the addict or whatever that model was. And that's unkind at best. And I agree with Dr. Rob wholeheartedly around that. I think that is unuseful. I mean, I don't know, those of you who are joining us today, you know, it doesn't feel good. I grew, you know, I had some background in my family with addiction. And if someone would have told me there's something wrong with me because I was born into a family, I mean, I'm like, there's no hope in that. Like, and honestly, we're in survival sometimes in those situations. We're just trying to figure it out and survive. And that's a big shift with Prodependence.
So you talked a little bit about timing for disclosure. And you mentioned, you know, could happen early, could happen a few months down the line. Now, I have had people who have said, I've been waiting a year and a half or whatever. And, you know, and I understand, especially when they're working with a professional and the professional is saying you're not ready yet or whatever, or he's not ready, she's not ready, whatever, but it's not ready. And, you know, like that has to be incredibly difficult and painful to deal with, you know, as well. And so, I mean, what are your thoughts on that, or how you could help, you know, I mean, how do you, you know, if I'm a client, how do I help know when the right timing is?
That's a really great question. And I really agree. I think that waiting period for however long it is, whether it's a week or, man, a year and a half is a long time, but that would be treacherous. It's like, okay, it's like impending doom, right? I know I'm going to get this information that's going to break my heart, and let me just sit around and wait for it until, and so that's a really, it's a difficult question to answer because I don't think there is one, but an exact answer that I could blanket it with. We want the addict to be at a place where he or she has no secrets. They're willing to tell it all. And they're willing to do it not only for the benefit of the partner and the relationship, but for their own recovery. We want them to be invested in the idea that the only way they're going to have long-term healthy sobriety and staying away from their own unhealthy patterns is they have to come clean. They have to get honest. And that's one of the hardest things for addicts, for an addict to do, because the lie is what keeps them being able to go on with their behavior. So the addict's therapist, whoever works with that individual, is going to really, because it wouldn't be a good idea to have a disclosure if the addict's still in lying patterns, if they're still holding information, if they're still, being defensive and gaslighting. That disclosure is not going to go well. The disclosure could be a bunch of lies. And so I would push, if I was a partner, I would, as much as I could, to say, I need this sooner than later, both online with my therapist and offline alone with a spouse or a partner. I'd be like, I'm not, I got to have this information. It's too hard for me to sit and not know, what's been going on. That's when a partial disclosure might be helpful too, Tammy, like you were discussing. Maybe the partner really just needs to know, have you physically had sex with another person, or have you been driving drunk with the kids in the car, or there's some of those. If I have that information, I could probably breathe and then wait for the rest of it to come out. But having disclosures, like we call that staggered disclosure. Thank you. Staggered disclosure, a little bit at a time over a long period of time, is just torture for most partners and family members. So really lean in with your therapist. Do as much as you can to prepare yourself to create safety for that, and really encourage your partner and, vicariously their therapist to keep working hard, and hopefully they'll be ready sooner than later.
Well, and what I'm almost feeling like, what I'm reading between the lines is, if I'm a partner and I'm not getting disclosure, my addict isn't doing so hot, I mean, that's what it would feel like. And so that would make me even feel more unsafe, with all of that too. So
yeah, that would be information, right? That's information for the partner. If there are situations where the partner's not ready for disclosure, where I've had we've had the addict like, yes, I just want to come clean, I want to move on, but the partner is having severe bouts of depression and maybe suicidal thoughts or things like that, we would definitely want to stabilize that partner and not keep loading things, more information on top of them that could potentially cause them more harm. So we're looking at a lot of different things when we're looking at disclosure for both individuals. So we can create this safe space to just get this information out, give it to the partner to have he or she support to help them through it and manage it, and a plan of action before and during and after, and the addict to have a before, during, and after plan of action for them. But I think what I really want to get across is get professional help, somebody who's highly trained, if you can, find somebody to help you do that, because that's best outcomes.
Qualified professional help.
Professionals, yes.
Yeah, because unfortunately there are many people that will dabble in this, and often, and it's always the partner. I feel so bad because it's always the partners that are left holding the bag, going, "This did not go well," and I'm feel worse. And there's something, and other people probably call it this too, but I call it the vomit disclosure, where, like, I'm going to tell you everything and free myself, and, of the organic nature that you brought up, but it's done, and, it's like, okay, phew, I feel better. And this poor partner just got dumped on, and, is left with all the yuck, and and with no pulling data together, no filtering and going, well, whatever, like details that they don't need, and she was really hot because, I mean, whatever, it can be said in a very hurtful way that is not helpful, and then there they are, and they're just supposed to go, oh, okay, and let me go do whatever my day was, and yes. And often, and this is, I don't want to make blanket statements, but often the addict is going like, well, now we're clean and now everything is good, so now we can move on from here, not understanding how devastating this, can be. Although pieces of it could be well, I thought you were lying when you said you were going on that company trip, and, and I was right. So, there are components of it where it's kind of like validating, because you go, okay, that, now I know my gut was more right than the words you were saying. So, but it's
Absolutely.
challenging.
And remembering that, and we often tell the addicts, you've been dealing with your truth, or not dealing with it, whatever. You've had your truth inside of you and for a long time, but this is going to be new information. He or she may have some of it, but not all of it. And so you're basically backing up your dump truck into the room, and you're going to feel so much relief, but he's going to feel very burdened by that information if they didn't know a lot of it. And so, working with that patience piece with the addict and saying, you don't get to decide what grief looks like and how long it takes, your partner to even want to talk to you again, or to deal with you, or to come back to the relationship. We don't get to tell people how to grieve, because that's essentially what happens. Now I've got all this information I have to put somewhere. I have to process that and put it somewhere. There's also, that's a major big disclosure, but there's also disclosure of, slips, relapses throughout the process of an addict's recovery. And those can be really painful, really painful. And, for partners, there's no easy way sometimes to hear that. There's no, and I always tell partners, you're not a robot. You are who you are. You feel how you feel. We certainly want to hopefully create a space in this healing journey where we can be honest with each other. The addict can be honest when they're imperfect, and the partner can be honest when they're hurting or they're upset. We want to start creating that connection between the couple, but you really, as a partner, need to decide how much information you want. If it's a sex addict, for instance, and he has or she has a slip with that addiction, first you have to know what their sobriety even looks like. What does that mean to them? What constitutes a slip or a relapse, or what does that look like? And then you need to decide and tell that addict what you want to know and what you don't want to know. You need to be in control of that information, I think, for best outcome for you, for the partner. I would like to know, I'd like to know within 12 hours. I would like to know, who or what, how much and where. I want to know the basic information. And then I want to know what you're doing about it. That's another really big piece that in an addicted relationship, we can, the partner can ask the addict for. Don't just dump the truck, bring the cleaning supplies with you, don't just don't vomit and not bring it with you. Then tell me, yes, I called my sponsor. I told my therapist. I'm telling you, I'm doing a slip prevention sheet that's going to help me keep out of that behavior and figure out how I got there in the first place. And because all that will create safety for the partner, and it makes them proactive, the addict more proactive about their behavior. And it keeps the partner feeling like, oh, I don't have to do anything. You don't have to do anything anyway, but it certainly feels more frightening when they're like, yeah, here you go. Just want you to know and talk to you later. That doesn't feel very good. So I guess what I want, just as a recap, just for partners to know, is you can be in control of how that information comes into you. And you can decide what's healthy for you and what's not, and ask the addict to, when they have to disclose slips or struggles that they might have, to do it in the way that works for you. Again, I think therapists can help with that too.
I think that's really important too, because you want to believe, after you've had this big formal disclosure, that, okay, now we've leveled the playing field, we're on the solid foundation, and we're going to just move on from here. So, it can be extra devastating to have there be, oops, this is what happened. But I do love that you talk about, and bring the cleaning supplies. Make sure you've got the plan, and, here's what I've already done, and here's what I'm doing, so that, that it can help mitigate that, that possible damage. One of the things I was thinking about too with disclosure that I think is important is, and often can be a stumbling aspect, is the financial aspects of, even if it's sex addiction, there are financial aspects of this. And I know partners can get really extra hurt by that. It's like, okay, this amount of our family budget has been diverted to this. We could have gone on a family vacation, but we never had the resources because you were doing this. And so, like, that's an important piece to include, for everyone's integrity as well.
I agree, because there almost always there's a financial cost to addiction, even if it's just lost time. If an addict is spending time during their work hours where they would be normally working to provide for the family, for instance, and they are acting out instead, what's my lost time? How much do you make an hour? There's going to be a loss there for sure. A loss of productivity, and then there's just money that could be spent. If I'm an alcoholic or a drug addict, I'm probably spending a lot of money on my substance. If I'm a sex addict, I might be spending money on a prostitute, or just lost time surfing the internet, or more.
The affair partners and hotel rooms, or even with jobs, it's like I wasn't productive at work and I missed a promotion. Like I could have been farther up the corporate ladder, so to speak, but because of my addiction, I wasn't fully present and able to do that. So that's a financial impact of addiction as well.
Big time. I also want to kind of circle back and say, one thing that partners really don't like to hear very often, and I can understand why, is that sometimes slips are a part of recovery. It doesn't happen for everybody. They don't have to happen. I want to put it out there in that way, but oftentimes they do, because remember, addiction is a brain injury. It's a wiring injury. Like, I have injured the reward centers of my brain. If I keep repetitively doing a behavior that brings me pleasure from something outside of me, then those hormones, those frequent use of those hormones, are going to create these well-traveled highways in the brain that have to be we have to walk that back through recovery. We have to grow weeds on those unhealthy highways and create new highways with new healthy behaviors. And so they aren't pleasant for the addict or for the partner, but they do happen sometimes. And I think the big caveat to those is, like I just mentioned, maybe somebody has a slip with an addict has a slip and they disclose it. I think bringing the cleaning supplies, in other words, telling the partner what I'm going to do about it, will tell you a lot about their recovery. Are they learning from that slip? How did I get there? What was going on in my life, and what areas was I out of balance, or I wasn't taking care of myself, or I wasn't accountable, or whatever. And that tells me I would be less frightened of that slip than an addict was like, yeah, I don't know, I just wanted to, and sorry. I mean, that's nice, but I think a person in some solid recovery will have a little more information for the partner. They'll be able to say, gosh, I don't know, I just stopped doing my daily routines. I stopped reaching out to my sponsor. You'll see those things, but they need to know that. It's not the partner's job to know any of that. It's the addict's job to know that and express that. Because I think then even if it's painful to go through a slip or a relapse, that addict knows what's happened, and they are being proactive about understanding it and getting help for it, or whatever it is they need.
And I think there's a really vulnerable time early on in recovery, because they are still so close to the addiction and they don't have enough recovery and enough tools to use yet. So that's a very vulnerable time. And then, like you just said too, the other time is when they start coasting because, oh, things are kind of good. So, well, I don't need to go to that meeting tonight. I'd rather, it can even be good things. I'd rather hang with the fam, well, that sounds nice. But if that happens too much, I'm not taking care of my recovery, then, I'm going to, I've seen it. I've been around long enough. I've seen too much of that happen. So it feels like, there's early and then the later. And, so if in the early time, they are doing things regularly, and I talk about, in recovery, people go, oh, I don't want to go to a daily meeting, or I don't want to daily do whatever. And I'm thinking, man, when I got into recovery, I had all kinds of free time because I spent so much time planning my using, it was it took hours every day. And so I had lots of time to reinvest in that. So, in recovery. And so, I continue, even though I've been around a while, to do things that are positive for my recovery, because that's my little insurance policy, that if that I don't have to go act out again today, and I would rather do that because I've seen people with 20 years go back out. I don't want to be that person. I want to be the person that just keeps, making progress, on that. So we do have a comment, a question. So I agree that a partner who is denied a disclosure ASAP is a partner who is tortured beyond belief and will experience detrimental health issues at the very least. I appreciate how far this model has come, but no one would withhold meds to a person with cancer until their husband was ready. The subject is so triggering to me because there doesn't seem to be a good solution. I really do appreciate the openness and exploring better options for the future. And I really do. I hear what you're saying. And I think that the challenge is the ASAP. It's like, going back to what we said is, it's the vomit disclosure. I'm not going to do that. I just did it 5 minutes ago, but I'm not going to do that anymore. And I'm going to tell you all about it because I want to free all of us. And then doesn't have tools, doesn't have whatever. And so, that kind of stuff keeps happening. And that poor partner who's going to be, disclosure after disclosure and never, be able to trust. Now, is a partial disclosure, is some aspect of it, is there some containment that would be helpful? But having a formal disclosure before the addict is even able to, to put all those pieces together. I mean, that takes a lot of time working with a therapist, to come up with what that plan would be. So that's challenging. So thoughts on this?
And I think another, maybe this is helpful too. I mean, when there's what we call behavioral addictions, or process addictions is the formal word. And then there's substance addictions. So substance addictions are obvious: drugs, alcohol, food is considered a substance addiction. And then we have process addictions: sex, gambling, and also food, believe it or not. That's the trouble with food. They're both, so it's hard to treat. It's a substance and a behavior, it's a process. So one thing that happens is with the alcohol, with the substance abuse, it's obvious we would never have a full disclosure with a drunk person or somebody who is impaired or intoxicated. They wouldn't be present. They wouldn't remember. They wouldn't be in their right thinking mind to do a proper and full disclosure. It's harder to see with the process addictions, with the sex addict, but there's similarities. You're drunk in a different way. You're not present in a different way. You have not been using the executive function of your brain very much either. So it would be essentially like trying, working with an impaired person, trying to get a full and honest disclosure. And I also want to validate and acknowledge how painful that is. I have seen this play out many times. As a therapist, I push for, disclosure as soon as humanly possible for that addict to be present. They don't have to be perfectly remorseful. They don't have to have every single thing figured out, because throughout the healing process and recovery for an addict, things will recover. They will recover memories throughout time, but at least that essential basic information, we'll push really hard to get that to the partner as soon as possible. But kind of think about it that way. There's impairment on both sides, and we have to at least get that person present and somewhat stabilized in their thinking before they'll even be able to sit through something like that. It's not an excuse.
Right. No, I 100% agree. And, and like I said, I feel so for the partners because it's like, I'm waiting. And then I'm going to get dumped on, and so hopefully they're working with a therapist. And I think, like you said, ideally they're working with, 2 trained therapists, and the partner's therapist can be talking to the addict's therapist and going, this even this partial piece of this would be really helpful for, for the partner to understand now. And, and then hopefully the addict's therapist can help, prepare even for that component of it, even if it's not a full disclosure, but, having two trained people that are able to communicate on, on some level to best help the couple,
I think it's a good example too. I'll just put another plug in there for the therapy. This is why in these situations, I believe both individuals where possible should have their own therapist that can advocate for both the partner and the addict. In our agency, when we do formal disclosures, it is a 2-hour session, and both the therapists for the partner and the addict are present. They have closely collaborated, and they are there to support their respective clients and to help them through that process. So it's a well thought out session with the therapist and the client. So it doesn't have to be done that way, but I have found over 15 years of doing this that seems to be the safest environment, and it seems to have the best outcome for both people.
Yeah, I like that. And I like that there's a kind of a finite time, and I'm sure, it can be a little bit different, but I've, heard of people that have 6-hour disclosures and all that. And I just go, oh my gosh, so, and I get everybody's different and needs different things too, but maybe the thought of me having to sit still and listen for 6 hours is, I don't know, it's probably my problem. So
I know. Well, I wouldn't like that either. I don't think anybody would. And I think, for our partners, when they're listening to the formal disclosure, there's lots of elements to that. There's different ways that disclosure is organized by the addict. Sometimes it's done in a timeline type disclosure. Sometimes it's done by topic. Sometimes it's done in a narrative, kind of a story form. The therapist can help them with that. And then for the partner, we encourage that individual to write questions as they come up. And sometimes they need to ask the question right then, and we'll allow that. And sometimes if they might want to just the addict might answer that as they go. So they'll just write down their questions. And at the end of the disclosure, we will invite the partner to ask the questions that were unanswered for he or she. And then we also have an accountability. I take full responsibility statement that the addict will write and give a copy of that, not the disclosure, not a copy of the disclosure, but a copy of the full accountability statement that the partner gets to keep. It's not your fault. You didn't cause this. There's nothing you could have done to stop it. It is my responsibility, not yours. That kind of that's the general, it could be very sweet and in their own words, but that's also a part of the disclosure process. And so both are allowed to, give the disclosure, ask the questions, but the therapists are there to kind of help moderate. And somebody gets too triggered or too emotional or just starts to sink into a place they don't want to be, we'll call a timeout. Anybody can call a timeout and go for a walk, come back when we're ready. So, there have been times we've rescheduled disclosures because it just got really difficult for one or the other, and we've just rescheduled it and brought them back. So work with therapists who can help you do that. And also that you will, as a partner, will not feel judged for having a response. As a partner is going to have a response, and usually a negative one, often a negative one. Fear or sadness or anger or hurt, or those aren't fun emotions to have, but they would be expected, from hearing painful information. So your therapist will want to hold that space for that, but help you explain that, maybe help you communicate that during that, to the addict. And so this helps to buffer all that and keep you as safe as possible.
Yeah, which, at the end of the day, a well done disclosure, is, can be healing. It's painful, but, I saw a study, and it was like for those that had a well done disclosure, it was like 90% of them were glad they had it. And, and even if they didn't ultimately stay together, it still ended up being, that was important for that aspect, that time of the relationship. And then, as they move forward, but, for those that have, you know, the negative disclosures, it's, you know, it's another fracture, you know, that ends up being a challenge to overcome.
That's right. And yeah, most it ends up being a very positive experience. And finally, I think for partners, it feels like we're finally playing fair in the relationship. You know, as painful as it is to know, at least I know. And at least then I can make informed decisions about my life. You know, with my partner telling me the things that they've been doing without my knowledge, and maybe things I didn't even know were affecting them or how it affected them. So some of you may be past disclosure, way past disclosure, and it might just be those, you know, little disclosures here and there along that process. But I want to reiterate, first, thank those of you who are here. I can't see you, but I know you're out there in virtual lab. So grateful that you're here. I hope you'll come back. I do this on the first and third Fridays at 3:00, along with other webinars. There's so many drop-in groups and webinars that other clinicians on this site offer. I would encourage you, as they fit, to participate in them. They're free. They are hopefully informative and helpful. And I would encourage you to bring your questions and ask the therapist, you know, questions that maybe are hard to get answered, you know, without, you know, maybe just education or information. Or Tammy is here and available to offer resources. And, you know, Prodependence is new. It's new as about coming up on a year. But I will say that most therapists like me, who only had codependent models to work off of with partners, are embracing it wholeheartedly. And I'll reiterate that the fact that if you are or have been in a relationship with an addict, that's not your fault. It's not because of your history. It's not because of something you've done or something you will do or something you could do. You probably love somebody who has issues, you know, that have impacted you in the relationship. And there's nothing wrong with you for that. And I think that's the overarching message of Prodependence is we love because we love. And sometimes we may love the wrong person at the wrong time for us, but we love because we were meant to attach to people. That's what creates healthy living and good mental health. And so the fact that you are either with somebody you're working through things with, or you've been there, the fact that you love them and wanted to try or want to keep trying makes you human. And I'm really grateful to be around humans that, you know, are on that journey. They're pretty amazing. So I hope you'll come back and join me and join some of the others.
Yes.
On the website.
Yes, please do. The whole list is on sexandrelationshiphealing.com. But yeah, on Sunday evening at 6 p.m. Pacific time, Angela Spearman has a Prodependent drop-in group where you can see each other and support each other. And then every Wednesday at 12:30 p.m. Pacific time, Brittany and Debbie alternate weeks, but every week now there is a Prodependent partner support as well. So, and there's lots of other resources too. Dr. Rob will be on In the Rooms tonight at 6 p.m. Pacific time. And then he'll be on Sex and Relationship Healing on Monday at 5 p.m. And Dr. David's on there. Lots. So go to the schedule, email me if you have any questions. So thank you so much, Kim. Great to see you. Thank you to those that attended, and we'll see you in a few weeks.
Thank you, everyone. Goodbye.
Bye.